Welcome everybody to the coronavirus Q&A, Facebook Live and Channel 16 Live discussion. It's been a while since we've had a Q&A session. I thought it would be good to get the city employees together who have been working hard on carefully and cautiously reopening Evanston. As everyone knows, we've moved from phase 3, which was the recover phase, into phase 4, which is the revitalization phase. I know there's lots of people out there that are anxious to get reopened, but also worried about what this may mean, particularly as we look at other states around the country who have seen a rapid rise in the number of new cases. I do want to report to folks here in Evanston that our numbers here continue to look really good in Evanston and even in the state of Illinois. We look at the 7-day moving average, and the 7-day moving average around here in Evanston continues to be about 2 a day. And in the state, it's around 700 a day altogether in the state. And we're seeing a slight uptick in the 7-day moving average at the state level, but it's not enough to read into right now. The fatalities here in Evanston stand just below 70. We're at 69 fatalities. Many of those have happened at the senior living centers. Our Illinois Department of Public Health and the City Department of Public Health continue to work really closely with those senior living facilities here in Evanston. The mayor's task force that I've talked about in the past for the pandemic continues to meet. We used to meet twice a week. We're now meeting once a week. With all the different sectors here in Evanston. So that's sort of where we are in terms of our numbers. I put a communication out to the community last Tuesday. If you don't get the messages from the mayor, if you just go onto the mayor's webpage, you can get that. And it's got a lot more detail of the data than I've just given you now. The Emergency Operations Center continues to be active here in Evanston. We are meeting tomorrow. We'll have our weekly situation report done by close of business tomorrow, and much of that information will go out to the community in the Thursday newsletter. So with that, let's go ahead and get into the questions. We have a lot of questions from the viewers out there. I've got about 4 pages of questions, so I'm just going to ask our panelists if they'll introduce themselves and what their role is with the city, and then with the pandemic, and then we'll get into these questions and ask that our speakers just be really crisp in our answers so we can try to get to everybody's questions. Okay, so let's go ahead and start with Ike. Why don't you just introduce? Tell you what, to save time for everybody, I'm going to ask you a question at the same time. And as I ask the rest of you a question, why don't you at that time go ahead and just introduce yourself, what your role is with the city, and if you have a specific role with the pandemic, what that is. So Ike, I'm going to start with you. And this is a question that's on the mind of many people, which is other states have seen a rise in cases after reopening. Are we as a city concerned about reopening too soon? And how are we ensuring a safe reopening? And this question, again, I know many people have, but Anita asked this question.
Yeah, absolutely. Hello, my name is Ike Ogbo. I am the Director for the Health and Human Services Department. And in my role, I oversee all operations in regards to the infectious rates, the infectious disease and COVID in the EOC by ensuring that we are applying precautionary measures and applying all the practices needed in order for us to limit the spread of COVID-19. So in regards to your question, as you know, Mayor, and perhaps others, the method used to reopen Illinois is science-based. It's based on facts, it's based on data, it's based on calculations to reopen Illinois. We're not reopening Illinois 100%. As you take a look at all the guidelines, we're opening Illinois based on certain capacities that we feel confident that it will go a long way in continuing to limit the spread of COVID-19. And these guidelines are put into place in order to guide us, in order for us to continue the practices, in order for us to comply with the recommendations, And it is all science-based. It's based on data, it's based on calculations. In Evanston, as you mentioned, Mayo, we have started to, of course, see a decline in the number of infectious rates in Evanston, a number of confirmed cases. So this is very calculated by the governor, and I think the governor did an excellent job in this crisis, where we've started to see a decline in the number of cases, and it is all based on health matrix, data, information, calculations to slowly reopen Illinois and our communities.
Thank you, Ike. And I think the big thing for viewers to understand too is not all states took the same approach that Illinois took. I mean, some of the efforts, as I viewed it in other states, was sort of half-hearted, right? They sort of had one foot in, one foot out. In Illinois, both feet were in. It was science-based, fact-based, driven by the experts in public health who made those decisions, and Governor Pritzker and his whole team followed it. And so hopefully we as a state will benefit longer term from the sacrifices that everyone made, including our businesses and our residents. Let's go to Lawrence next with the and I'll have Lawrence introduce himself. But Lawrence, question on many people's minds, particularly people with small children. Are playgrounds open? If playgrounds are open, when will they be cleaned? What will the procedures be? What about District 65 playgrounds? And what are the primary safety concerns with playgrounds? So I'm going to ask you, Lawrence, if you'll start off on that, and then Ike, just if you want to add anything as a public health official to that, and then we'll move to the next question.
Thank you, Mr. Mayor, and good afternoon, everyone. Lawrence Hemingway, Director of Parks, Recreation, and Community Services. And so, Mr. Mayor, you asked about playgrounds. So right now, the state of Illinois has left the decision of opening up playgrounds to the local municipality. There have not been any guidelines issued from the state in regards to playgrounds. So the city of Evanston has decided to open up its playgrounds, and we will be moving forward with opening up the playgrounds by removing the caution tape that has been put up at the beginning of the pandemic. Now, the question about cleaning the playgrounds. Unfortunately, we will not be cleaning the playgrounds, Mr. Mayor, but what the message is that is important to the community is that if you choose to allow your children to play on the playgrounds, that you practice social distancing while you are on those playgrounds. I'm not aware of any Parks and Rec agency that's disinfecting their playgrounds. They're just not built and designed or managed in that way. But we have decided to open it up as long as people practice social distancing. And so working closely with the health department, Ike and his team, they have created and have working on some guidelines that will be posted to try to keep the community safe while they choose to utilize our playgrounds. Another part of the question, you said District 65. We will be in touch with both District 65 and the Ridgeville Park District in the community to let them know that the city has decided to open up its playgrounds and let those entities manage those playgrounds at their own discretion.
We have an official open date for the playgrounds, Lawrence?
I don't have an official date. We are working with Public Works, so I'm hoping by the end of this week, as they are out doing their regular maintenance routines, excuse me, that the staff will be removing the caution tape from the playgrounds as they are addressing the regular maintenance in every park in the community.
Okay, thank you. And Ike, do you have anything you want to add to that? As well as, is sun a disinfectant for the virus?
Yes, so with our playgrounds, we are crafting guidelines that are going to be quite strict when it comes to our playgrounds. Just given the nature of course, the kids playing in the playground. And the onus is going to be, of course, on the parents to make sure that the kids are social distancing and wearing their mask. And as Lawrence alluded to, we will not be cleaning it. We will leave that to the parent to bring sanitizing wipes to wipe the playground equipment if they must use the playground. So we're hoping that before the expiration of this week that we will have the guidelines posted on our website and through our other communication channels so that people can review it and prepare themselves as they go to the playgrounds. And as we perhaps know, the risk of transmission at playgrounds are quite low. Indoor transmission is quite high. And that is why the governor and the guidelines are not allowing indoor playgrounds at this point. And as Lawrence alluded to, it is left at the discretion of the local municipalities to establish whether playgrounds are going to open or not. And we are going to open the playgrounds with strict guidelines.
Okay, thank you. And I know a lot of families, including possibly the five that asked this question, which was Emma and Jim and Katie and Susan and Khadija, who all asked that question. I do want everyone to understand here locally that contact tracing, you read about it in the newspaper, and what that means is if someone is a confirmed case of COVID-19, they do contact tracing. Who else did that person come in close proximity to? And then ask that person those other people that were in close proximity to self-isolate and quarantine. We have been doing that here in Evanston since day one. I think it is a big reason why the number of cases per capita here in Evanston is lower than we're seeing in Chicago, where they weren't able to continue to do contact tracing since day one. So there's catch up there. And when we do contact tracing, and the public health experts do it, they look at where people are possibly getting the contagion or the virus. And as our public health director just said, most often that is indoors. It's at home, it's at the workplace, it's at church or a theater, if a theater were open, and all of that. I think people are going to continue to self-regulate and self-govern themselves in terms of the degree of comfort they have, whether it's their children playing in a playground or going to a gym or a salon or anything else that's now open under the revitalization phase. Let's move to the next question, which is from Laura. I'm going to ask Laura Biggs if she'll introduce herself and share with everyone her role, but also answer this. Families have been removing caution tape around playgrounds, Laura. What can the city do to prevent people from using these closed facilities? Now, we just heard in the answer to the previous one that we are going to be opening them with guidelines coming from our local public health. But in the meantime, right now they are closed, and yes, you can drive by and you can see some kids playing in playgrounds. So what can the city do to prevent people from using these closed playgrounds? Welcome, Laura.
Thank you. My name is Laura Biggs. I am the city engineer, and I'm also overseeing some of our recovery operations. I would say that we have tried to distribute messaging through our regular outlets. There is potential that we're investigating maybe posting some signage at playgrounds to help people understand some of the guidelines. But at some point, we have to rely on the residents of Evanston to have a little bit of personal responsibility about this. And it's when we all follow the rules that we protect each other. And that, as the mayor's indicated, is what helps keep our numbers of infections low and makes our city as successful as we have been in fighting this contagion.
Thank you, Laura. And again, all in all, I really feel like Evanston residents have done a good job complying with the directives. And again, I think our data is showing that positive result. Let's see, Lawrence, got a quick question for you. What's the plan for basketball courts? And this was from Steve. It may have been from me or another Steve, Lawrence.
Hey, thanks, Mr. Mayor. I'm excited to say the city has also decided to open up our outdoor basketball courts at this time. And so again, it takes a little time to go back and replace the basketball hoops that we have physically taken down. And we are working on that this week. Over the next 5 to 10 days, you will see the basketball courts at every park back up and all of the barricades removed that will allow the public to enjoy the outdoor basketball courts. But again, I have to reemphasize the safety component. It is allowable, but again, you need to practice and be smart as a resident while you're out there participating in practice. Good habits to keep yourself safe and others safe while playing.
Yep. Thank you for that. And for people that are watching, I would just say, again, it's imperative that all of us follow all of these public health guidelines, because if we do start to see those numbers increase, don't be surprised if the governor's office and the public health experts say, hey, we're going to scale back some of these things. And so while we would never think it's a privilege to use a basketball court or a playground, given that we're in a pandemic right now, we need to do so just cautiously and following the rules, because I know none of us want to have to take a step back. Tim, I got a couple questions for you. When will the Evanston Public Library open, and what are the plans for the public library? And this is from Bob and Sharon, who asked these questions. So if you'd introduce yourself and give us an update.
Sure, thanks. Thanks, Mr. Mayor. Tim Longo, Access Services, Head of Access Services at the Evanston Public Library. So yeah, the question on everybody's mind is, we like to say the library never truly closed. We just moved a lot of our services online, but people still want to know when the doors are going to be opening. So Monday, July 13th, we're going to be opening up the main library in a limited capacity to allow the public in to access computers and technology. And at the same time as that's going on, we will still be having our curbside pickup that's been running for 2 weeks that will allow people access to the collection. And then in terms of the branches, that's a lot harder decision right now to make due to the size of our branches. So the branch's reopening date is still to be determined, but we're talking about that internally.
So can you go over that part, because I missed it just at the beginning where you talked about the library opening for the use of digital?
Yeah, so and the press release for this will be out within the next few days, but Monday, July 13th at Main will be opening in limited capacity to the public, but only for use to come in and use computers, the internet, and other technology. And as I mentioned, there will be a press release within the next few days on that. This is the first time this has been mentioned to the public at this call.
Yes, that's the first time I'm hearing it.
Yeah.
And so do you know how many people you would be allowed to have in the library to use those?
We're still working out the exact details on that. Ike was in yesterday. We're going over that, but it will be limited based on suggestions from Ike and suggestions from, the other rules with the phase 4 guidelines. So we're working that out, and that will all be in the press release that will be coming soon.
Great. Wonderful. That's exciting news. Thank you, Tim. Ike, a quick question for you. Renee, who's watching right now on Facebook Live, asked, how safe are salons?
With all the industries, there have been guidelines provided, including salons. And as we are going to salons, we have to ensure that we apply those recommendations. So wearing your mask as you enter, making sure that you're social distancing. So these things need to be employed in order for one to protect him or her. And also, it is recommended that those who are providing care, salon care, hair care, that they ensure that they go through screenings, that they wear their masks, that they employ social distancing. So even as much as one protects him or herself, the staff at the salons and the barbershops at personal care industries need to also protect themselves as well and make sure that they are employing the guidelines provided. There are specific guidelines for personal care, saloons and barbershops.
Right. And so I would say to residents, if you ever go into one of these establishments and you find that they're not following these guidelines, you should call the city's 311 and make us aware of that. And then Ike will have someone on the public health team check in with that establishment and make sure they're aware of all the guidelines they need to be following. All right, we got a question now for Paul. So Paul, this is from Randy. What are the plans for closing off downtown streets to allow more space for dining, sitting, shopping, and music? I know a lot of people are excited about what's happened in the main Dempster Mile over there on Custer. So why don't you take it away on this question? Please.
All right, thank you, Mr. Mayor. That's my favorite question to answer because there's some life coming back to our business districts. Essentially, the city council approved a really flexible program through the end of kind of the sidewalk season, which is generally October, to allow restaurants to, I'm speaking about restaurants now, but we could also talk about retail, sidewalk sale kinds of businesses as well. But for restaurants, there are basically 3 or 4 types of outdoor options. You can do an outdoor sidewalk cafe. You could seek a permission to do a street closure like they did on Custer. There was a collaboration between several restaurants, and they checked in with their neighbors and they checked in with neighboring businesses to come up with a good plan. It allows a lumber truck to deliver lumber throughout the morning, and then in the evening, the restaurants are able to open up and really kind of expand their revenue opportunities. These poor restaurants have been really, really hurt by COVID, and this provides an opportunity for them to make some money, but also allows for people to get together once again and enjoy what they enjoy about Evanston. There's a Sketchbook, for example. They're using a small park across the street from them on Chicago Avenue, limited hours. They promise to restore the park at the end of the season. And that provides a little beer garden for them for a short period of time. I think they have committed to closing at sunset. So again, it's just an opportunity to be in the fresh air. And then if other restaurants are interested, they can use city parking lots or parking spaces on the street. So that's how I would summarize how the outdoor cafe process is working. And there's quite a few out there. We're communicating, I think, in a citywide newsletter today. I think we have approximately 60 outdoor cafes at the moment. By the way, my role with the city, I serve as the economic development manager.
Great. Thank you, Paul. And we all appreciate the work that you're doing with all of our business districts and business owners. Does the city communicate with residents who live near newly created street closures or sidewalk cafes to notify them? Or you just mentioned the Sketchbook using the park over
Sure.
there.
So as part of the process, we've asked businesses to check in with neighboring businesses and residents. So that is something that we ask when they come through the design and project review process.
What about the tables downtown? Has downtown Evanston put those out yet? Because my office, for my company is downtown, and on this nice weather, I want to go out there and eat a sandwich, but the tables haven't done that.
Well, it's funny you asked that. I have a little bit of a sunburn from yesterday from sitting out there, and I enjoyed a 10Q chicken.
Good.
It felt like old times. And while I was sitting there, a group of summer youth employment teens with Evanston shirts came out with, I don't know what they're using to clean it, but a bunch of rags and cleaning supplies wiping the tables down. So the tables are out. I don't mean to put Lawrence on the spot. I don't think the fountain's being turned on because it's considered a pool, but please enjoy the Fountain Square Park. It's great. It's back.
Good. And will downtown Evanston be having music there this summer on Thursdays like they've done in the past?
I don't know the answer to that, but I'll quickly find out and I'll put it in the chat.
Find that out and maybe we can get that on here. And Lawrence, what about the fountain?
Well, Mr. Mayor, I was going to answer the question about the music. Downtown Evanston is now working through a strategy on how they can set up socially distance to allow their concerts to proceed. We as a department are going to be allowing our concerts to take place in our park, the Starlight concerts. And so we're working with Downtown Evanston now to strategize and spread out, make markings, come up with a strategy so that they can offer safely some downtown concerts. So
Great.
Just wanted to answer that for you.
Great. And I just want to, again, yeah, go ahead, Laura.
Oh, I can answer the question about the fountain. We did have a discussion and we've elected not to open the fountain. First of all, it's really difficult to police people from staying out of the water and making sure that they social distance when we get such good participation when that fountain is open. But in addition, not opening it allows us to provide more plaza space, and people can better socially distance when they do participate in the downtown activities. So we feel like there's an actual benefit to our restaurants and businesses to keeping the fountain closed this season.
For all those that are watching and are thinking, oh, this sounds like a bad idea. We're getting people together outdoors, whether they're dining outdoors or they're at the fountain square. I will remind you again, public health experts are saying, be outside. We want you outside. Yes, practice social distancing, wear the mask, keep 6 feet. And we've seen this community be able to successfully do that. I mean, we've had the marches for Black Lives, several of them, thousands of people getting together. And we were concerned, all right? And we looked at that data 14 days out, and we did not see an uptick in the data here with confirmed cases of COVID-19. So it means that those human practices that we can each take can make a difference, and being outside can be still safe for us. All right, let's see. Laura, quick question for you. Under phase 4, will outdoor yard sales be allowed? And this is a question from Sean.
Currently, outdoor yard sales are not allowed. The permits for those go through community development. It is something that we are investigating to better develop guidelines for, so they can be.
Okay, all right. Great, thank you. And then Lawrence, this question's from Alexander, but I've had many people email me this, so it's not just Alexander. Why were beaches closed to swimming during phase 3 while Wilmette's beaches were open? Was it because of the state guidelines, or were there reasons specific to Evanston?
Yeah, it's specific really for us. During phase 3, Wilmette made a decision as an independent park district to move forward with opening up their beaches. We as a city agency, the phase 3 guidelines didn't allow that operation. So the city of Evanston, through its health department, are following the state guidelines. And so we started to plan to open up during this current phase, and, proud to announce tomorrow. But the reason why Wilmette did it versus the city of Evanston, they have an independent park district where we are a city department. So as an independent park district, their elected body chose to move forward with their own guidelines, where the city is following the state guidelines pretty much to the T.
Okay, follow up on that. This one's from Stefano. Why were masks not required at Evanston beaches before July 1st? How will health and safety guidelines for beaches be enforced?
Well, the first part of that question, it is an outdoor park. So we treat our beaches during our non-peak season as an outdoor park. We asked people to wear masks at our parks, but they weren't required to. Again, it's a guideline. And so we treated the beaches that have been open up to this point just like we did our parks. A lot of people get outdoors and exercise and enjoy Mother Nature. They're not wearing a mask, and that's okay as long as they are socially distanced from people not in their household. And so that's how our beaches were treated. Starting tomorrow, we're requiring folks to wear a mask while they enter, and that's to protect the staff as well as the individuals coming onto the beach. Once they get on the beach, they're welcome to take their mask off. Obviously, when they're in the water, they're welcome to take their mask off while they are socially distancing from other families. And so that's the real difference of why before July 1, people were able to just come onto the beaches and not worry about it.
Okay. All right. Thank you. Luke, we got a question for you. So if you'd introduce yourself and then give us some color on this question. Will Northwestern be opening this fall? If so, what are their plans for dealing with COVID-19?
Sure, and thank you, Mayor. My name is Luke Stowe. I'm currently serving as the Interim Director of Administrative Services, and my Emergency Operations Center role is currently a co-lead for the Recovery Task Force, along with Laura Biggs. My focus is more on the community aspect. In regards to Northwestern, they do have a 6-step plan for COVID-19. They're currently in step 4, which is what they're calling the summer stabilization. Later on in mid-August, they'll move to step 5, which is the fall ramp-up. And then in mid-September, they'll start their new academic year. Most colleges and universities are planning, especially the Big Ten universities, are planning to attempt to have some sort of normal or relatively normal fall academic year. There will likely be significant modifications and restrictions. City staff has been working with Northwestern, will continue to work with Northwestern this summer and fall to ensure that we're working and collaborating together for the benefit of the community. But obviously there's substantial challenges for colleges and universities on this front. Northwestern does have the advantage of starting later in September, so they may be able to see what other colleges and universities are doing right or doing wrong in the month of August.
And Northwestern did just come out yesterday, I saw, and said that they're only going to have 1 student per room for those students that come back to campus.
That's correct, and they've also dropped the housing requirements for freshmen and sophomore. They do not have to live in university housing, and I believe they are also encouraging Northwestern students that live in the Chicago area that are within a commuting distance to drive in each day as opposed to staying locally in Evanston.
What about Northwestern football? Any update on that?
So the latest update on that is I believe they're looking at 3 different scenarios. One would be kind of a regular, football environment with fans. Another with limited fans. Right now, the Phase 4 guidelines for the state of Illinois, I believe, calls for only 20% of spectators. So that'd be a substantially different environment at Northwestern's football stadium. There's another scenario where they may play football, but with no fans, just basically players and staff, umpires, referees, etc. The key is, hopefully there will be no impact to the TV portion of this, because that's obviously an important revenue source for all of us if the TV revenue remains stable. Obviously, there is going to be some impact on the local Evanston economy if we have a situation where there's either no fans or limited fans.
Great, thank you. Ike, and that question was from Eileen, who was asking about the opening in Northwestern, so thank you, Eileen. Ike, another question related to Northwestern. They're an institution and a big one, and the biggest one we have here in Evanston, but they don't live in their own world, right? They interact with Evanston, the students and the faculty and the staff are downtown and everything else, and that's what we want, and it's partly what makes this a pretty vibrant community. So Barry, Nancy, and Louise all had the question, how is the city coordinating with Northwestern to ensure safety when students return to campus this fall? Many of them come from different places where face coverings and other measures aren't required like they are here. What is Northwestern doing to ensure that the safety of students? So Luke talked a little about that, but I'd like you to talk about the coordination that, I think, I want people here in Evanston to know that there is coordination between the city's public health department and this big institution in town.
Absolutely. So we've started having conversations with Northwestern University regarding the public health protocols that have to be put in place for staff and students to return to campus. So it's one of the reopening strategies that we have been discussing. They already have established a number of protocols so far that are well decided on. That includes PPE acquisition, PPE distribution, includes living layouts, includes disinfection protocols. These are already well in progress, but there's still some protocols that we are still fine-tuning and refining, which includes testing protocols. So this conversation is still ongoing. As a matter of fact, I have a meeting this evening to continue this conversation with Northwestern in regards to their reopening strategies.
Great, thank you. And just for people that are watching, Northwestern is a part of the Mayor's Pandemic Task Force that we started right at the beginning, so back in March. And so they have an important seat at the table there. Quick question from Rachel, Katie, and Jessica, who I'm guessing all have children. And I guess, Luke, I'll throw this to you. When will public schools be open here in Evanston? I know we don't have any of our superintendents or their staff on the call. They too are part of the pandemic task force that we have here in Evanston. But Luke, can you take that question?
Sure. Yeah, and we've been working very closely with D65 and D202. And to your point, they've been a part of the task force from the very beginning. We're also working with schools to ensure they have the proper PPE that they need for the summer and for the fall, to ensure that they're getting the PPE that they need at competitive pricing. So special thanks to Roger Sosa, the Evanston Chamber of Commerce, for helping out on that front. But in regards to the schools, one of the challenges is the Illinois State Board of Education just came out with a 60-page document for schools and how they are certain guidelines and specific restrictions. So both school districts, as well as our other private schools here in Evanston, school districts around the state, are still in the process of reviewing this 60-page document to figure out what will work and what will not work. Both 65 and 202 have put forward essentially about 5 different options, ranging from school like it was before COVID, all the way to fully remote and virtual, and then 3 options in between. So they have a lot of work to do. I know Dr. Witherspoon has said that he's hoping to have another 7 or 10 days before he can come out with additional information on what 202 is doing. And I believe 65 is in a similar situation.
Yeah. And I know District 65 has put together a really large task force. I think, I don't know if Lawrence or you or Ike, I think we have city staff that are on that task force. And they are looking at all the different options on how they best reopen. So I don't know if you have anything you want to add to that, Lawrence, if you're on that task force.
Yeah, I've been participating at one of the school district task force. They are working toward the various options. Right now, the options are that they're really trying to vet is the return to school, and so the task force is broken into 4 different groups. And those groups are one virtual. Focuses on if learning becomes completely virtual, if learning is back to normal, everybody comes back, if there's hybrid models. So there are different 4 different task forces looking at the different options. And right now, because it has been announced that there's a return to school, a lot of the focus is working on that particular task force and their recommendations on how the community comes back safely. I think we come back together on the 17th, and they'll be working internally on the work so that they can make their public announcement. So they're working very hard to get that done.
Thank you. I know this is something that is really stressful for parents, right? Particularly as their employers may be calling them back to work and everything else. And I'll just assure people there are a lot of people in this community, from the school districts to the city to nonprofit organizations, who are all working together to try and figure out what this is going to look like and how it's going to work. And it's going to be difficult for everybody, and it's very complicated. There's a lot of nuances here. So hopefully we'll have more to report in July on that. Ike, I mentioned earlier about the number of deaths that we've had in Evanston, fatalities due to COVID-19. Sadly, that number stands at 69. Many of those were in nursing homes or senior living centers. This question is from Susan and Anita. What is the city doing to strategically assist nursing homes and prevent infections? And how can we do a better job? I mean, that fatality rate is awfully high there.
Absolutely. So it is sad that our long-term care facilities have been greatly impacted by COVID-19. We have suffered a significant number of deaths at our long-term care facilities. So from the onset of COVID-19, we embarked on training, guidance, implementing public health protocols, also infectious disease control measures, PPE, proper usage, screening, and you name it all at our long-term care facility. So we have provided guidance to a long-term care facility in these regards. And not only that, we have worked with experts in the field. We've worked with infectious disease doctors affiliated with the Illinois Department of Public Health and North Shore Health System to ensure that these public health protocol infectious disease control measures and the management control measures are implemented at our long-term care facilities. And not only that, we have also conducted on-site visits just to make sure that these protocols and infectious disease measures are implemented and executed at our long-term care facilities. And as many know, or many do not know, the city has provided thousands and thousands of PPE to our long-term care facility to aid in the infectious disease control and for them to be successful in implementing these controls. And the PPE has ranged from gloves to N95s to gowns and to face shields. So we've provided this. The last time I checked, there was a total of over 23,000 PPE items that we've had to disperse to our long-term care facilities. And not just that, we have also worked with our long-term care facilities to promote testing, which aids in infectious disease control and symptom management. The last thing that I would add is we recognize that our long-term care facilities need help, and that's why the department hired a specialist. And the specialist, her job is to primarily focus on our long-term care facilities and provide them clinical perspectives of COVID-19 and provide guidance and the public health protocols needed in order for them to be successful in disease control and symptom management in our long-term care facilities.
Thank you. And through the pandemic task force that we set up at the beginning, my direction to each of the leads of all these different sectors was to form working groups within that sector. I'm really pleased that the senior living sector, which is chaired by Mary Leary, the CEO of Mather Lifeways, has set up a weekly meeting that occurs between all these senior living facilities that never interacted with one another before the pandemic, but it's so important that they do to share concerns and to get information. And Illinois Department of Public Health has been attending those weekly meetings, which is also another source of valuable information, epidemiological information for those facilities. So there's a really close relationship. It is scary because once that infection does get in there, even though they're following all the public health protocols, it still can spread. What are the guidelines for reopening retirement communities? Ike, do you want to take that one too?
I can take it. Currently, there are no guidelines specific to long-term care facilities for phase 4. In conversation, we are hoping that there will be some guidelines as we approach phase 5. And I think it is at phase 5 that our long-term care facilities and retirement homes will be allowed to fully reopen. And as we perhaps know, our long-term care facilities house our most vulnerable population. So we're trying to protect them at all costs by not immediately reopening these facilities. So as it stands, there are no guidelines for reopening our long-term care facilities at this point.
So not for full reopening, but I thought I read or was in a meeting and that the state did come out and said that they could, meaning each facility could decide on their own, but allow residents to meet outside with family members, again, practicing social distancing.
Right.
They couldn't come into the facility, but they could go sit on a picnic table.
Right, and that's absolutely true. This guideline came out maybe about two weeks ago, where they are allowing people to visit. It is two people per resident, but they're not allowed to come inside the facility. They can actually have outdoor meetings, so to speak, or outdoor visitations. But even in the process, even if they come into the facility, they are required to undergo screening and temperature checks. So they're doing everything to ensure that the COVID is not brought into the facility. So at this point, everything remains outside.
Yeah, I've been impressed. I've gone around to some of the different senior facilities, living facilities, to speak on the closed circuit TV with the residents, and the procedure's been really, really tight, which I was pleased about. Last question on this area of seniors: is the health of home healthcare workers monitored? And this is from Jane.
So they are monitored. So in this situation, the state has established what we call a testing protocol. So each facility is to develop their own testing protocol. And the purpose of the testing protocol is for it to aid in infectious disease control. So in that regard, staff are being monitored. If you, of course, test positive, you're required to stay at home for 10 days, a minimum of 10 days. And if you are direct contact to that individual, you're required to quarantine. So in that regard, the staff who are taking care of our residents at our long-term care facilities are being monitored. And of course, before they start their shifts, they are screened. They make sure that the temperature checks are done. They're making sure that they ask the relevant questions as it pertains to symptom checks. So it is an overall system in order for us to continue to limit the spread of COVID-19 in our facilities.
Okay, thank you. I've got a couple quick questions that I'm going to take. What is the status of PPEs and where is the city acquiring them? So I mentioned the Emergency Operations Center. It's still active here. We have a logistics chief. It's named Sean Cholik, who's also our facilities manager with the city. And their job is to make sure we have on hand all of the PPEs that our city emergency responders need, as well as preferably an emergency supply so we can support some of these congregate living centers on an emergency basis. And the city's done the staff have done a really good job. And so that's on our weekly situation report. We can see all the numbers, and they look good in terms of us having adequate supply right now. Again, we are monitoring all of this closely in conjunction with the overall numbers and which direction the numbers are moving. As far as where we're acquiring those PPEs, we don't have Sean on the line today, but it's a variety of vendors that we are using to get those. And then we had a question from Tom on Facebook Live who said, how about a break on this year's property taxes? That would be I think everybody would like that. I can't promise anyone a reduction in the property taxes. Property taxes, everybody knows, is set by the county. It's on a county basis. The County Board of Commissioners did, though, pass a ordinance which gives everyone an additional 60 days if you need it to pay your property tax bill. Okay, so property tax bills are in the mail. If they're not in the mail, they're about to be in the mail. People are going to get them in the next week or two. And you will have an additional 60 days over that deadline if you need it to pay. I know that's not as good as a reduction in the property taxes. This pandemic has challenged everybody from our residents to our families, to our businesses, to our city. The city manager estimates our revenue, our tax loss this year alone, and our deficit to be $12 million. It may possibly go up depending on how the reopening goes and what type of revenue our businesses are generating. And so it's if we slash and said, okay, we're going to reduce our property taxes by 50%, it just puts the city into greater debt, and we have to have a balanced budget. That's by law. So unfortunately, I don't have the exact news you probably wanted, Tom, which was, yes, we're going to be able to reduce our property taxes, but the county has given people a break there if you need it. And that's for everybody that pays their property taxes directly. If you're escrowed, then those are automatically paid on time. So anyway, so that's that. Quick question, Ike, from Letitia. Why is there no walk-up testing site in the 5th Ward, and where can somebody be tested for antibodies?
So recently, we conducted a 2-day free testing program, coordinated, of course, with Amita Health. We've been able to test over 175 individuals from free. So what we're planning on doing in July is to have a number of testing events. We are hoping that we will have such events in the 5th Ward. We are still finalizing plans on where that's going to be and the specific dates as to when we will have those tests. But the 2 events that we had, I believe, were successful, and there is indeed a demand for testing in Evanston. And I apologize for those who came to, I'm going to use this opportunity to apologize for those who came to the testing site yesterday and had to be turned away because we ran out of tests. But we are working with North Shore with the media to ensure that we have ample tests going forward, so that everyone who comes to get tested will get tested. Where can someone get free testing at this point? Given that we are conducting this free testing program, you'll be able to get free testing there. And the state has also set up a number of facilities where individuals can go and get tested. You don't need any doctor's referral to get the testing, and that information is provided on our website.
What's the positivity rate at these days? I can just explain it.
So the positivity rate, the last time I checked, was about
2%. So for people who are watching, it means 2% of the people that are tested
Right.
on a daily basis are testing positive for COVID-19. That's come significantly down. I mean, when we were first starting in this pandemic, it was 25%, then 20%. And the overall percentage is something like 7% or 8% positivity rate here in Evanston. And we've had close to 9,000 people, if I remember right from the last report that I saw that event.
Approximately 9,000 people.
9,000. So that's good. All right. Let's see. So this is an interesting question from Julie Ike, and I've never asked this question or heard this question asked before. Are people tested post-mortem to determine if they had COVID-19, even if they didn't present any symptoms?
So a couple of months ago, CDC started reporting what is called probable deaths. And these are deaths that are associated to a viral record criteria where the individual didn't test for COVID-19. So it is left in the hands of the medical examiner to determine, based on disease sequence and disease process and symptoms, to determine if an individual has passed away due to COVID without a test. And what happens in this regard is that it actually gives us an overall picture of the exposure of the disease, because you're adding these probable deaths and probable cases. So that gives you a vivid picture of the exposure and the community spread of COVID-19.
Interesting. Thank you. Question for you, Paul. And this is from Jim. If a worker at a restaurant or retail establishment tests positive for COVID-19, will the city alert the residents?
Yeah, that's actually a question for Ike, Mr. Mayor.
That's a question for me.
Right.
So as you know, Mayor, contact tracing.
Paul knows the answer, he just doesn't want to answer.
So as you know, contact tracing is a vital tool that we implemented right when we received our 2 confirmed cases in March of this year. So if a restaurant worker tests positive, what we'll do is we'll, of course, get in touch with that individual and do what we call contact tracing. And if an individual is identified as being a close contact to the person who tested positive, then we'll contact that individual. So there are two phases to this, where we do the case interviews. The case interviews is conducting an interview with the person who tested positive, and contact tracing is getting a hold of the individual who was in direct contact with the infected person to ensure that that person is quarantined properly. So this is not information that we broadcast on our website or through social media or anything like that. The individuals who have been identified as close contacts, or the people who we talk today, the public health message, and of course relate to them what the risk that they might have because they've been in direct contact with someone who tested positive for COVID.
Similar to a question that we've received before in the past of, can I know everybody in my neighborhood that's tested positive for COVID-19 or on my block or on my street? And again, for privacy purposes and everything else, and because they do contact tracing, those that are notified. The rest of us, don't know that. So real quick, we only have a few more minutes, so I'm going to ask a question that Andrew, Joan, Kim, Barry, Chris, Ignacio, Ruth, and Jean all asked. A lot of people ask this question. Are residents still required to wear face coverings in public and practice physical distancing in phase 4? And are face coverings required for customers when entering a business? What about outdoors such as downtown? So Let me give you the first part. Are residents still required to wear face coverings and practice physical distancing in phase 4?
Yes, in phase 4, it will become a norm. And as you remember, we issued an order for universal face coverings here in Evanston. So in situations where an individual cannot practice social distancing, you are required to wear a mask. For example, if you go to a grocery store or if you are in a confined space where you're not able to meet the 6 feet requirement, then you're required to wear a mask. Whether if you're outdoors or if you're in a public setting or if you are just walking by the street or you're in a crowd, now that we are allowing about 50 individuals at a gathering to wear your face covering. So it is an order that was issued from our public health office. So it is what we are requiring people to do, to wear a mask.
Okay. And Paul, what about, are they required when entering a business? And what about outdoors, such as downtown Evanston?
Right. First of all, it's important that patrons just assume you wear a face covering indoors. While eating, of course, you have to remove your mask to eat and drink. But for all practical purposes, just assume to wear the mask indoors. And don't try, and I'm just going to ask and I'm going to appeal to everybody to practice kindness and patience. This is new for everybody. Just because there isn't a sign on the door that says wear a mask doesn't mean don't wear it. Just assume to wear it. Don't put the shop owner or the restaurant owner or the staff in a position where they have to ask you to leave. They don't want to do that, and they want to be safe too. So please just practice patience. And the short answer, Mr. Mayor, is yes, wear the mask. There was a question about fitness. While working out, you don't need to wear the mask, but between working out or as you're transitioning between working out and locker rooms, wear the mask.
This question's from Sally. Do you foresee a future without masks? If so, when will that be?
Well, in phase 4, it is a norm now that we're in phase 4 to wear your mask, and especially in situations where it's impractical for you to practice social distancing. I will see that the requirements will be relaxed in phase 5 when there's an effective drug or vaccine to combat COVID-19. But as it stands, it is going to be a norm for a while because it appears that we are going to be in phase 4 for some time until there is a development of a vaccine or an effective drug in phase 5.
Okay. Here's a specific question, and I think it's an important one because many people in Evanston do live in apartments or condominiums. This is from Gwenda. She says, I live in an apartment complex. Are face coverings required in the elevators? How many people are allowed in an elevator at a time? And what can I do to ensure my apartment building manager is enforcing the rules?
Right. So elevators or confined spaces, my recommendation would be as you're entering an elevator, if there are individuals there, to wear your face mask. And while you are in the elevator, instead of facing people face to face, maybe to turn your head around or maybe even face the walls of the elevator. Or if you approach an elevator and it's crowded, maybe waiting for another elevator will do a world of good. But if you have to use the elevator and there are a number of people there, I would recommend definitely wearing your mask. And what she or he can communicate to the building manager is providing this message to the residents in the building about the requirement for face coverings and also having posters in the vicinity of the building where it's visible, where people can actually read what the requirements are. And, highlighting, limiting the number of people in elevators. There isn't any guideline that illustrates how many people can fit in an elevator in this COVID pandemic. So we have to use our judgment and discretion as we are entering our elevators.
Yeah, it was a good question. And a tough decision that people have to make about, am I getting in this elevator? There's other people here. Am I waiting? Just a couple more questions because we've almost gotten through them all. This is from Jason. Is it possible that increased gathering sizes will be allowed as we progress in phase 4? For example, could the limit increase from 50 people to 100 people if infections continue to decline? Because Facebook is a long time, right? I mean, Facebook.
Yeah, it's going to be a long time. So I see an opportunity if we continue in the way that we're going now. Right now, there is a downward trend of infectious disease that COVID presents. So if we continue to apply the recommendations from CDC and IDPH, I see an opportunity where it will increase from 50 to more people. But it requires a lot of effort from us for us to continue applying the recommendations and the practices and social distancing and washing our hands and staying home while you're sick in order for us to get there. And as you mentioned, Mayor, we're going to be in phase 4 for some time. So I can see an avenue and opportunity whereby we'll allow more people at certain gatherings. But as it stands, in phase 4, we are only allowing 50 people or less at gatherings.
All right. We have a couple questions, and I'd like to get through them because this way we don't have to have another session right away, and we will have answered everybody's questions. I also know a couple of our panelists probably have to drop off for other meetings. So I could tell you the folks that I really need left are just Ike and Paul. If the rest need to drop off, but a big thank you to our Parks and Rec Director, Lawrence Hemingway, for being with us today, for Luke Stowe, and Tim Longo over at the Evanston Public Library, and for that really positive information, Tim, come July 13th, when you'll be able to use the internet and computers, and we'll get more information out to the public soon there. So I understand if you need to drop off, go ahead. A couple of quick questions. Ike, this is from Jennifer. Will Evanston develop an app to identify people who've been in contact with someone who's tested positive for COVID-19? This is something that we've seen in other countries, and I think other places within the U.S. are trying this. I'm not quite sure how effective it is yet.
Yeah, so it will all depend on how effective it is and if it matches our protocols and our measures that we have for contact tracing. I am open to the idea of looking for a gadget or a device that can aid in our contact tracing. But I think the methods that we've used have worked effectively. And to be honest, I think that the decline in the number of cases in Evanston can be attributed to how we did our contact tracing. So it still remains an important tool, the way that we are conducting contact tracing. But if there are other avenues that we can explore, I mean, I'm open to that idea.
I agree. I agree with you. I really think so too. And again, our per capita numbers, number of people in Evanston that have COVID-19 over 10,000. Out of 10,000 people, we got about 104 in Evanston. And in Chicago, it's like 184 or something around there. So contact tracing makes a difference. We've been doing it since day one. We're going to continue to do it, app or no app. Real quick, what is the percentage of error for the COVID-19 tests? Do you know what the error rate is? How confident can people have?
Yeah, I'll have to take a look at that. I mean, some PCRs range between 70 to 90%, but I'll have to really check to provide the exact.
My suggestion for people would be, wherever you're getting the test, if it's Anita St. Francis or North Shore, ask them, what level of confidence that they have that this is the correct result. Okay. Paul, this is a question that I've heard before from folks. People love the movies. It's been hard. You haven't been able to go to the movie theater, see some of these big. When will Cinemark be open?
That's a question of the hour. Cinemark is working with the property owner to come up with a plan to reopen. I don't have a timeline yet to report.
Okay. Why are free COVID tests not being offered? This is from Jennifer.
So as it stands, we have been partnering with Amida Health to provide free testing for our residents. As I mentioned, we've conducted 2 events, and there are going to be subsequent events. In July, we're hoping to have 3 events in July, and we also want to get our other healthcare providers on board to help us with the testing as well, so that we can reach Evanston residents who do not have any other means to have free testing at these events so that they can get tested. And just to let you know, Mayor, that the first event that we conducted where we had 75 individuals, the results came out. So all 75 people tested negative. So that is wonderful. So I just wanted to add that.
And we've got the Erie Health Center here in Evanston over on Dempster. People can go online and you can get a test if you don't have the means to pay for it for free there. You just have to register as a
Yeah, you have to register as a participant. Mm-hmm. And not only that, on our website, there are free testing sites that the state has already established where individuals can go, and you don't need a doctor referral. You can just go and get your tests at those locations. And the information, like I said, is posted on our website.
All right. We're going to wrap up with something that all of us have to do, which is sometimes use the restroom. Karen asks, it's safe to use public restrooms, especially if we're going to open the movie theater, or the movie theater reopens, and we've got the beaches that are reopening, so we have city public restrooms. So can you just talk about that, Ike?
Absolutely. So for each industry, there are recommendations for high contact surfaces and toilet rooms, restrooms. They qualify as high contact surfaces. So in that regard, as long as you are following the cleaning and disinfection protocols, it is okay. So it is okay to use a restroom as long as the business owners and the people responsible for the upkeep of the restrooms ensure that they're cleaning it and cleaning it properly. The recommendation for most restrooms are every 2 hours to clean and disinfect the restrooms, and to also use EPA-approved disinfectants. If you employ these measures, it will be okay for one to use the toilet rooms, the restrooms.
Thank you. Okay. Well, thank you, everybody, for joining us today. As I mentioned at the beginning, it's been a while since we've had a coronavirus Q&A. I thought it was important to do it as we enter into phase 4, the revitalization phase, which we couldn't be in for quite some time. I appreciate all of the questions, and I want to give a big shout out to Patrick Degnan, who you don't see on the screen, but who is our public information officer for the city. This disaster, unlike so many others, requires the involvement of every single person. We all have a role to play to follow the instructions of our public health professionals like Ike Ogbo and Dr. Ezike here in the state. People have done a good job with that here in Evanston. We need to remain vigilant and continue to do a good job. We do not want to have to take a step back, and we want to reopen, but we want to do so cautiously and carefully, and with people's health in mind. And so the numbers continue to look good, thanks to everyone's hard work. Let's continue down that path. We as a city will continue to monitor this situation closely, and work with our state elected officials and other state officials if adjustments need to be made, and advocate on behalf of those as well. So thank you, everybody. Be well. Bye-bye.